Welcome to the second installment of near infrared. This is such an important concept, and I want to examine today the potential benefits of near infrared therapy. First of all, near infrared therapy, which is 40% of the sunlight, and their good reason is it has so many potential great effects for human health. One is it's an antioxidant. Now, we all know vitamins and minerals are an antioxidant, but the sunlight carries within it the perfect antioxidant, which we call the near infrared part of the spectrum. We also note that it can stop the inappropriate protein binding. Now, what that means is as we get older, proteins fold in the wrong direction. And when they do that, your body actually can't use them appropriately. It's an aging, inevitable situation. However, by utilizing near infrared on a regular basis, it stops that from happening. So not only is it an antioxidant, it also represents a great way of anti-aging. It also increases growth factors. Now, in most instances, we want tissue to live, to become something else, eventually die, and then allow a movement for a new tissue to come into a being. So we want to have some growth factors that help our body change. You know, we're changing cells pretty much every day in some cases, and others take longer than that. One of the most important things of near infrared is our microcirculation. Let me explain. There is little tiny hair-like projections that are the terminal projections of your vascular system. They are terminal. They're the things that literally end in the tissue itself. So like in your heart, these little tiny hair-like structures bring the blood, the nutrients, and take away the waste material simultaneously. Now, it is the cause. 46% of heart attacks are in the microcirculation. So anything that can improve that microcirculation is certainly wanted and warranted. Well, there isn't really any good drugs that does that. None. However, the near infrared does that on a regular basis, can literally increase that circulation that's so small, smaller than a hair, that we can't bypass because it's terminal. We can't put a angioplasty in, and we certainly can't open up with any kind of instrument or do a stent. It also helps near infrared the cell signaling. Now, when I say cell signaling, what I mean is two cells need to talk to each other. They do, especially if they're aggregated into some organ system. So how do they do that? And how do you improve that? Well, near infrared improves one cell talking to the other, which means if you do that, you're going to get tissue that's been damaged to regenerate. Most of our tissues can regenerate with the proper nutrients and the proper impetus as near infrared can provide. It also increases this near infrared, the amount of oxygen. Remember, no oxygen, no nutrients, no ability for any tissue to live. So the near infrared, while it's improving that microcirculation, is actually regenerating the tissue simultaneously, is increasing oxygen too. So when this local circulation is improving, it helps so many different systems. One, which pretty much anyone would think of, I'm sure, is the skin. There are so many skin ailments, and recall that the skin is a reflection of what's going on the inside of the body. It reflects itself on the outside. So diseases like psoriasis and eczema are pretty much a look at certain difficulties biochemically that are happening inside. But the near infrared easily penetrates the skin and easily helps it to rejuvenate and become healthy again. It also does what we all have the problem with as we get older, and that's the loss of collagen. It allows that tissue underneath your skin to keep you looking young, to keep your hands looking young, etc. And by that use of near infrared, it literally improves that collagen while you can eat properly and take vitamin C and things of that as well. One other thing that we all forget about, but we know so much about, is lymphatic drainage. Near infrared can improve lymphatic drainage. Now remember, lymph nodes and lymph channels do not have any pump. They lie between muscle layers. So as the muscle layers squeeze, it moves the lymph. There is nothing more important than moving lymph. Think about it. Anytime you've talked to someone who has an early diagnosis of cancer, what's the first thing you ask? Is there lymph involvement? Well, one of the ways to keep lymph moving so that it doesn't become clogged, it doesn't get impregnated with cancer cells, is using near infrared to make that process go smoothly. And most importantly, and this to me is the essence of near infrared and the secret of near infrared, because the place in our cells that makes our energy, which we call ATP, adenosine triphosphate. If we have no energy, cells don't live. So you can't imagine anything more important than improving the amount of ATP being made. It stops cancer, it stops heart disease. Pretty much every disease, including diabetes, is a loss of this precious energy or fuel in our body for every cell. Well, guess what? Near infrared helps stimulate that. You're thinking, what? Light can do that? Of course, because in our mitochondria, where we make this ATP inside our cells, there are things called chromophores. Chromophores are substances or little things that pick up light, and it's the light that stimulates this ATP. Now, it may sound to you like, oh my gosh, can near infrared do all these things? And I would say, think of the sun. Always go back to that. Can the sun make you feel better? Does the sun include so many things and aspects that keep us healthy? Is the sun what's been given to us by our Creator is something that can keep us healthy and alive for a long time? Then you'll perfectly understand what we talked about today and the functions of near infrared. On our next installment on near infrared, we're going to look at the importance of the Nogier frequencies and clinical applications that I use in my practice all the time. I look forward to being with you soon. I'm Dr. Mitch Genn.